At MedShield Medical Scheme, we don't just talk health, we do health. SMS MedShield to 33023 or talk to your broker to get your kind of care.
What do you know about cervical cancer?
I know that it has to do with something called an HPV virus. You have to go and get a pap smear twice a year, type of thing, yeah.
I know that cervical cancer is a cancer that affects the uterus. That's about it.
Cervical cancer is actually an uncontrollable growth of somatic cells on your cervix. So yeah, it's basically uncontrollable growth.
Well, it's basically a cancer related to like your uterus and the cervix area. It affects ladies.
I know that cervical cancer affects your uterus.
Yeah.
And so the first symptoms are you're bleeding and your period pains. So
yeah.
So what I know is that it's basically cancer of the cervix, so it has negative effects on a woman's uterus.
Yeah.
What I know is it can cause you to not be able to have babies at the end of the day.
Yes, that's cervical cancer. Now, cervical cancer remains one of South Africa's biggest women's health problems, affecting 1 out of 41 South African women. It is estimated that this disease will kill approximately 8 women in the country every day. And the World Health Organization's projections are that this number will increase to about 12 deaths per day in 2025. Now, these alarming statistics should be seen in the context that cervical cancer is a preventable disease. Now, September is Cervical Cancer Awareness Month. So today we focus our discussion on cervical cancer. We'll be joined in the studio by the Director of Women's Health and Genetics from the National Department of Health, 2 specialist obstetricians and gynecologists, the other one a fellow in gynecology oncology, both of them based at Charlotte Maxeke, Johannesburg Academic Hospital. We also have a cervical cancer coordinator from Right to Care and 2 cancer survivors who are going to share their personal stories with us. Now, we invite you to be part of this show by asking the panel some questions or just simply sharing your views with us. And if you want to do that, the number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. We want to go for a short break, after which we invite you to please just sit back, relax, and learn from this bumper show ahead. I'm Dr. Sello Mutaung, and this is Health Talk.
At MedShield Medical Scheme, we don't just talk health, we do health.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Northern Makutle. I stay in Kagiso in the Westland. I was diagnosed with cancer at the age of 40. I had difficulties from my womb complications at the age of 15, and I went to a GP for a general checkup, and as pap smear was suggested, and I was found to have cancer, but I was told that it is early stage, it can be cured. I had a minor operation. 3 months later, when I went for checkup, it was discovered that I had 2 tumors on both ovaries, and a hysterectomy had to be suggested. I had that. I had 2. When I was diagnosed with cancer, it was very scary Number one, I didn't know anything about cancer except that it was a killer. I had mixed emotions with 2 teenagers, an unemployed husband for 4 years. I had to undergo that ordeal, trying to find out what menopause and all that had chemo, and by that time I didn't even know what the name chemo was. In that frustration, I was angry with the family doctor that we had for 10 years that he could have done that earlier. But anyway, I had to go on with that cancer. In our costume, when a womb is removed, you are stigmatized. I was stigmatized. My in-laws were influencing my husband, who turned against me and started physically abusing me. I suffered with no one to support me except my 2 teenage daughters and my mom. But by the grace of God, I went through that ordeal. And 5 years later, I had a mom who was 74 years who also was diagnosed with cancer. And because I did survive, we had hope that my mom will also have survived. I am here today. I am 53 years of age. Very proud to say cancer is just a weed, not a killer, and telling people out there, especially underprivileged people, that as soon as you find out that you are with cancer, speak. Don't be quiet. When you speak, you'll be helped. The earlier it is detected, the better, and you can be cured. So go out there and make sure that you go for screening. Ask any questions that you need to ask. Come out. Don't keep it to yourself. It's not good for your health. I am a living testimony. Cancer does not kill if it's detected early.
That's very true. Cancer does indeed not, it cannot kill if it's detected early. Well, that's what we're going to be talking about today. We're going to be talking about cervical cancer. And let me introduce my special guest for today. Let me start with the lady closest to me. She's Dr. Manala Makua, who's Director, Women's Health and Genetics, based in the National Department of Health. Welcome to Health Talk, Dr. Makua.
Thank you.
Right. And in the middle is no stranger to this show, Dr. Lusanda Shimange-Matsose, who's a specialist obstetrician and gynecologist based at Charlotte Maxeke Johannesburg Academic Hospital. Welcome to Health Talk once again.
Thanks for having me.
Right. And last but not least, for now, we have Sister Sibongile Ramutsila, who's a cervical cancer coordinator from Right to Care. Welcome to Health Talk, Sister.
Thank you for having me.
All right. Perhaps let's start with you, Dr. Lusanda. We're obviously talking about something, we heard that sad story,
yeah.
But let's start from the basics. What is cervical cancer? Where does it come from? Let's start perhaps describing to us what the cervix is.
Okay. So the cervix is part of the uterus. The uterus has the womb has different parts to it. We know it's got the tubes, it's got the ovaries, it's got the body of the uterus, and then it's got the cervix. That's the part that's between, basically, it's at the end of your vagina. So in layman's terms, we call it the mouth of the womb.
Right.
And around there's a specific area that we call the transformation zone. Mm-hmm. And that is where the genesis of cervical cancer occurs. So cervical cancer is a cancer of the mouth of the womb.
Okay. Quite interestingly, I hear you say cervical cancer, some people say cervical cancer. Is there a different way of saying these things, or do they all mean the same thing?
Tomato, tomato, potato, potato, cervical, cervical.
It's exactly the same. Okay. How serious a problem is this in South Africa, Dr. Makua?
The problem is serious, and the extent of seriousness of a problem is that we will realize that since 2003, the program that we've been having from the National Department, it was mainly focusing on screening. Hence, we're having a screening program only. The hope was that we would encourage women to come earlier and get screened, and then we would keep the disease at that point. But now, when we look at the disease progression so far, it's actually now getting even worse, because it's now actually even affecting more younger women. Originally, we used to say we would screen from 30 years and above, because it used to be common at that point. But now we actually diagnosing more cervical cancer even at the earliest age of 12, 13. So I think mainly it's because of many other contributing factors, but that's how severe the situation is.
We're going to come back to the contributing factors, but Earlier in my introduction, I shared some statistics, to just indicate just how many women die of this disease on a daily basis and the projections, done by the WHO for 2025. Do we have a sense of what the actual statistics are like in South Africa?
In South Africa, unfortunately, we do have the statistics for the diagnosis, but we've got a lag time. The current information that we have is from the National Cancer Registry, which is dated 2012. And we've got about 8,500 cases that are diagnosed. But unfortunately, we don't have a process to say, that was only from pathological point of view, but we don't have all other components and the progress to say how many deaths. Well, then we use projections to say, but obviously from the situation that you're having from individual facilities, we actually having a situation where we've got more than 50% fatality rates from the cervical cancer. It's scary, it's sad.
Let's get a sense of how do people present? How will someone know that I have cervical cancer?
So you get two groups of patients. You get the ones who are just coming for normal routine check, and you pass a speculum and you see a mass, something that maybe a tiny mass, or you see some abnormalities on the cervix, something that they haven't really been aware of. Or they come and they're complaining of a foul-smelling discharge that is blood-stained, intermenstrual bleeding, meaning bleeding in between your normal cycle, or painful sex, or postcoital bleeding, which is bleeding after you've had sex, and then they come and just, want to find out what the problem is. And when you take a full history and you examine the patient, then you find a mass on the cervix. You biopsy it, and then it comes back as cervical cancer. So most of the time, it will be a patient who have those presenting symptoms: the pain, the intermenstrual bleeding, the foul-smelling discharge, which they can't really connect. Yeah.
Sister Sibongile, let's hear from Right to Care. Now, first of all, you're the cervical cancer coordinator for Right to Care.
Yes.
Just tell us a little bit about what your job entails at Right to Care.
Okay. Right to Care is an NGO which focuses mainly on HIV and related diseases. So cervical cancer, as Dr. Makwa said, that with nowadays with the new infections of HIV, for instance, most patients, they end up being diagnosed with cervical cancer at a very early stage compared to before. So as Right to Care, initially this cervical cancer program, it wasn't there. But as we looked at, okay, these patients won't die now from AIDS because they'll be getting HIV treatment like ARVs. But now they will die from cervical cancer because, for instance, where we are based at Helen Joseph, it's not a gynecological hospital. Patients had to go to Rahima Musa for those gynecological diseases. Then Right to Care decided to start a cervical cancer screening program. So that's where we started. We screened our patients, those who came to Thembalethu for their ARVs. But then we saw a need that it's not only patients at Thembalethu who needs these services. Then we partnered with our government, the DOH, to go to the clinics and assist with making sure that patients who need to come for screening, they do come. We offer health education. We also assist in training the nurses at the Department of Health to make sure that they screen the patients for cervical cancer. So in a nutshell, we are a cervical cancer prevention program. We don't do treatment. The only treatment part that we do, it's only when it's pre-cancerous, before the patient is diagnosed with cancer.
So you're based in Helen Joseph Hospital. Are you part of the hospital as such, or is it just that, this is your home, as it were, where you operate from?
The head office for Right to Care is at Helen Joseph. We're part of the hospital, but there's a wing for Right to Care. And we work hand in hand with the government. We help government to sustain and strengthen their services. So we work hand in hand with the government. We're not a separate entity.
I see. What is the prognosis for cervical cancer generally, and how has this progressed over time, if you don't know me?
Yeah, the challenge is, as soon as someone hears that they've got cancer, they think their life is over.
Right.
And it's not really the case. It's really dependent on what stage of the disease you actually present. So we know that if you present early, you have a good, what we call 5-year survival.
Right.
And obviously the later you present, then the more challenging it is in terms of managing it. But it's not to say that once you're late stage, you're going to die the next day.
So the message is the earlier
you present, the better.
Right.
And like Sister Sibongile said, is that they deal with more precancerous.
Right.
And if you really catch it at the precancerous stage before it becomes an overt cancer, then the prognosis is extremely good.
Let's hold it there, because we need to now understand what impact cervical cancer actually has in our society and perhaps in our healthcare system in general, and what are the causes and risk factors. For that, please stay with us. We'll get that after the break.
If we're talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, ceci bon.
MedShield, embracing our members in good health since 1968.
Welcome back. We're talking cervical cancer with me and my guest, Dr. Manala Magua, Director of Women's Health and Genetics based at the National Department of Health, and Dr. Lusanda Shimange-Matsuse, Specialist Gynecologist and Obstetrician based at Charlotte Maxeke Agrivic Hospital. We're now joined by another special guest, Joy Mulligan. Now, Joy is a cervical and breast cancer survivor who's here to tell her story. Welcome to Health Talk.
Thank you for having me. Good morning, everybody.
All right. Thank you so much for accepting our invitation. I mean, clearly, we're talking about issues that may actually be quite hard to talk about. And we commend you for coming out to say, I'm prepared to tell my story. Can you just briefly share your story with us in terms of, cervical cancer?
Briefly, yes.
Yeah.
So long. I was hijacked in 2008, doctor, and the guys that hijacked me, they put their hands over my breast and they squeezed it so hard, unknowingly that because we have very strong cancer history.
Yeah.
And I didn't, I never went for tests. I just said, no, it will never happen to me. My mom, my granny, and then the one breast started to get blue and black. So I went to the doctor and he sent me for MRI scan because I started to have, the guys that hijacked me, I threw myself down and I fell in an awkward position. So I hurt my back. And I went to the doctor, they sent me for MRI scan, and the scan came back, the doctor said to me, you should go for mammogram. So I said, doctor, I'm not here for my breast, I'm here for my back. And then they did the operation, I've got 6 screws in my back, and then I went with my younger sister because she also lost a breast the few months before that. And Dr. Ben said the same thing to me, I'm like, deja vu. So I went and the doctor found precancerous cells. And
in your breast?
In my breast, doctor. Okay. And the breast was still black because the guys put his hands on my breast and he squeezed, and then his hands went down to my private parts. And then they wanted to push me back in the car, but I threw myself down on the ground, so that's why I hurt my back. And Dr. Ben suggested the double mastectomy because we've got a very strong cancer history.
Yeah, I'm not trying to rush you. I just want us to get to the part about cervical cancer.
Yes, and then I went to the doctor again because a few months after that, the hospital put me on tamoxifen.
Yeah.
It's a tablet that prevents cancer to come back in your body. And then a few months after that, I started to bleed excessively. And I thought, as mothers, you just say, it's just a normal period, or your headache is just normal. Take a tablet or something. And I went to the doctor and he said to me, you must go for pap smear. No. And then I went, doctor, and it was cancerous, but in the first stage. So I had a hysterectomy the next day. But so
you survived all of that?
Yes, I'm a true survivor. I'm blessed and divinely favored. That's what I can say.
Right. And I mean, it's obviously clear to everybody watching that you can survive.
Yes, you can.
All right. Before we carry on, let's take a caller on the line. Nyambeni from Gauteng. Nyambeni, welcome to Health Talk. Is Nyambeni still with us?
How are you?
We good. How are you, Nyambeni?
Fine. I'm from Harangwa.
Yes.
Yes, I did this last year. Last time, and then they called me on May. They tell me that I have SIN. So since they referred me to George Mukari Hospital, when I go there, they told me that it's full.
Yeah.
I'm still waiting for the call. I don't know.
So you went for a pap smear. You don't know what the results are.
They told me the results.
Okay. All right. Okay. And do you know what the result was? What did they say?
SSIN.
Ah, okay. CIN1. Okay. Okay. And basically you'd like to know what that means. Okay. Thank you very much, Nyambeni, for your call. Let's give it to Dr. Shimanga.
Okay, so when you do a pap smear, it's a cytological evaluation. So you're just looking at the cells, right? And then obviously that gets processed, and it will either come back as it's normal, or they can't really say, they can't say what, it's undeterminate, but they can't exclude a more severe precancerous lesion, right. Or it could be low-grade cell, or it's high-grade cell. So now, where it differs is, number one, are you HIV positive or are you HIV negative? That will have an impact in terms of the follow-up. But if it's something that is high-grade cell, then we refer the patients further to do what we call a colposcopy, and that's basically looking at the mouth of the womb under a special dye to see if there's any cancerous lesion. You look at the changes with that, and then you take a tissue, an actual tissue sample, which goes to the lab, and then that will tell us, is it cancer or not? Okay. So if it is, let's say, CIN.
So, yeah, in this instance, she says it's CIN1, and, she'd like to know what it actually means.
Well, and just to put her at ease, if they say it's full, because we know which pap smear reports to act instantly on. And unfortunately, we are burdened by a lot of patients and so forth. But in this stage, I don't want to say she should not worry, but if it is early precancerous, it's something that can clear itself, but because of her age as well, it's something that should get looked at.
All right, okay. We're gonna. I need to talk about we must talk about the causes and risk factors, but perhaps let me stay with Dr. Shimanga, because I need to come back to you to ask about, the risk factors. Okay, the environmental, the stuff. Yeah, let's talk about causes. Joy earlier mentioned something about her family. She comes from a cancer, Does it mean that if you have a family member who's had cancer of the cervix, you are likely to have cancer of the cervix yourself? What are the genetics like?
Look, there are other cancers which are more, you're more worried about genetics. And that's not to say if someone in your family has had cervix cancer, you must just oh no, there's no genetic predisposition. No, there is always the fact that there is a cancer, right? But the main cause would obviously, as we know, is the human papillomavirus, the HPV virus. But if you do have a significant history of cervical cancer, it's not something that you must keep to yourself. You definitely need to let your health practitioner know.
Any link between breast cancer and cervical cancer in terms of risk?
No.
Right.
No.
Right. Let's talk about the other risk factors, Dr. Makua.
Let me take from exactly what the doctor just said, HPV, exposure to HPV. I think we know now of the program where we're saying in the department we're immunizing young girls.
Right.
But we also know that actually there are boys who are having the virus.
Yeah.
So some of the interventions would be at the societal level. This is one of the interventions, because what we know is HPV is one thing that you're likely to be exposed to when you're sexually active. Hence, the vaccination is for girls who are not yet sexually active.
Okay. So we're going to come back to the intervention. So essentially we're saying that exposure to HPV virus puts people at risk of developing cancer of the cervix.
Yes.
Now, we hear that there's different types of these viruses, the HPV virus. Now, let's talk about that.
Yeah.
Your comment on that?
Yes, there are. There's a lot. There is a lot. I'm not going to go into details, but for all intensive purposes, what must be known is that there's high risk and there's low risk.
Yeah.
The low risk are the ones that give you the vaginal warts.
Yeah.
Right. And then the high risk, those are the ones which will give you cervical cancer if the infection persists. So there is a lot, but the ones, for the sake of the show, is the high risk HPV that puts you at risk of developing cervical cancer.
What about association between lifestyle issues such as smoking and alcohol intake and cervical cancer?
Yes. Earlier on, we indicated that we cannot exclusively say that cervical cancer is familial or genetical endowment, but there are risks that could expand your risk of developing the cervical cancer. Yeah. So if you smoke, for an example, and you are over 35, your risk is far more higher.
Okay.
But
so it's never good to smoke.
It's never good to smoke. So
we're going to have to go for a break. Let me take this opportunity to thank Joy Mulligan and Dr. Lusanda Shimanga-Matsutsa. Thank you so much for your time. Okay, folks, we're going to go for a quick break. When we come back, we now start talking prevention. Please stay with us.
At MedShield Medical Scheme, we don't just talk health, we do health.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well. If we're talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield, embracing our members in good health since 1968. MedShield, embracing our members in good health since 1968. SMS MedShield to 33023 or talk to your broker to get your kind of care.